Yay! So it's nice and rainy here. Just gotta love that rain.
Yay!
And so today we're going to talk about a rainy topic called Gall Bladder. Surprise! We didn't tell you what our topic was going to be, but this is for all you gallbladder people. You know who you are. So anyways, in case you're new to us, I'm Dr. Smith, and I'm from Accomplished Health and Wellness here in Lawrence, Kansas. It's not so lovely today because it's raining, and we might all float away. And this is Heather Fiore, and she's from Free State Nutrition, and she is here in Lawrence too.
And this is my rainy day hair.
Yay! Yay! Hey, I'm liking it. This is my rainy day hair. Actually, if it gets really wet, it starts to like curl up in the back. So then it's all uneven. It's kind of crazy looking.
That would be this right here.
Yeah.
Crazy looking.
Yeah. My son, he's 3, and he has the cutest little curly hair. And so when it does this, it like really gets curly, and I'm jealous of his hair because it's so cute. So I just run my fingers through it and act like it's mine. I guess in some fashion it is.
It is, yeah.
Anyways, we're going to talk about gallbladder today. So everyone, your gallbladder is, if you look at any pictures, it's a green organ. And it looks like a part, like, you know, when you blow in a balloon, so you blow the balloon, and then like it's all small, and then you blow it and it stretches out a little bit. That stretched out look, if it was a green balloon, that's what your gallbladder looks like.
Cool.
Right?
And what does the gallbladder do?
So your gallbladder actually creates bile salts, and then that's actually what helps to process your fats in your diet. So it helps with fat. But, you know, and where does it sit? So your gallbladder is actually on the right side, and it's, so when you have gallbladder pain, it's going to be right, and we call it the upper quadrant. So you break your stomach into 4, like a plus sign down the middle with your belly button in the middle. And so the right upper quadrant, that's going to be where your liver and your gallbladder sit. And then part of your gut sits there too, of course. And so your gallbladder actually sits underneath your liver, right? So it's all kind of connected as it dumps into the intestine, the small intestine. So, and it's an important little organ, and it is a sac. Just like, you know, I described it as like, it looks like the little balloon that you blew and then it kind of stretched out. It actually is a sac, and it holds the bile salts in there and bile acids, and then it squeezes them out, and then they go out into their little tube, and then they actually will combine with enzymes also from the pancreas, because they will, the tube from the gallbladder and the tube from the pancreas kind of combine, and then they all drop into your small intestine. And so that's why sometimes, like, if your gallbladder goes bad, it can back things up into your intestine or into your pancreas, and then you can get pancreatitis. Or you can get a little stone inside the duct, and it will block up into your pancreas too. So it's kind of crazy. You know, the funny thing is that this is very interesting. So if you get your gallbladder taken out, they'll take it all out, but you can actually have a little bitty stump left, and it can produce bile salts, and it can actually get stuck, and you can get another gallbladder attack from the. Yeah, isn't
Why
that
would
crazy?
they do that?
Well, it's not like
no.
They go all the way back as far as they can, and then they'll snip it and tie it off, and so that but the tubing all has to remain. Right. So sometimes you can have some cells in the tube that still produce stuff.
Man.
And then they can, So anyways, this, a lot of times, so your gallbladder can have different phases of infection, actually. So you can have something called sludge, and it looks like,
scary.
Right? It looks like sludge, actually, in your gallbladder. Yeah. So it's all sludgy and like mud in there. And then you can have stones. And so stones are like, your gallbladder looks like a bag of stones. And they look like stones. And they're hard like stones. And you can like bounce them on the table when you take it out. You can
Great.
Hit them, and they're hard, like stones.
Okay. That's serious.
Yeah.
Sounds painful.
Now you understand what we do as residents.
Play
when
with
we're
people's
learning,
gallstones.
we're learning, and we really want to see what's in there and how much. That's the other thing that's interesting is how many stones are in there, right? So when you do pathology rotation, you actually get to cut it open and like open it. And it is amazing how many stones and sludgy stuff can be inside this little sac.
Wow.
Yeah.
Okay.
So you can have gallbladder attacks with either one, sludge and stones, but usually they won't take out your gallbladder unless you have inflammation around the gallbladder, or it looks like it's not functioning. So there is a test that you can do to look at the function of the gallbladder to see if it's squirting anything out. And so they'll kind of determine that based, your next step based on what's going on. Are you really sick? Are you getting septic and taking your gallbladder out? It's going to be the best thing.
Right.
Do you have sludge and it's not working well? Do you have gallstones and it's just not working well? Is it really big? That kind of things. How many attacks have you had over the last year?
Sure.
That kind of things.
Okay.
And some people just, they're like, I'm done. Take it out.
And does a gallbladder attack tend to mean gallstones?
No, it
could just mean the
either.
sludgy thing.
Oh. Yeah. And so gallbladder attacks are going to be right upper quadrant pain, and we call it colicky pain. So it's like a stabby pain that will kind of wax and wane, will get better and worse and better and worse and better and worse. But it's like an ache with this like cyclic, crampy type colicky pain. Okay. And it'll be worse when you eat fat. So if you think you have gallbladder and then you eat some fried chicken and then you're like doubled over in pain in that right upper quadrant, guess what? You were right. It was your gallbladder. So if you're having gallbladder attacks, you can offset them by changing your diet a little bit.
Sure.
And you can improve your long-term prognosis. So,
got it.
Treatment's going to be antibiotics, surgery, depending on what's happening. So. Okay. And this is one of the organs that also affects other organs. So if you're constantly having gallbladder attacks and pancreatitis, maybe you should look at your diet. Right?
Probably.
Because you can change things with your diet.
Yeah. Well, I guess it depends what you're doing already, but
most people that have like a pretty good diet, usually they're not getting gallbladder. Now there's always an exception to the rule, but
sure,
for the most part, they aren't getting gallbladder attacks.
Right. So it seems like a healthier, meaning more higher fiber. Fruits and vegetables, whole grains type of diet.
Legumes. Don't forget your legumes.
Definitely. And then like healthy fats.
Yeah.
Can be good. And I don't know. I'm making this up. When I read that, healthy fats are actually good for prevention. It sounded, the way it was described was like, it's almost like exercise for your gallbladder. Like eating healthy fats means that your gallbladder is going to release bile. And so it's good, it's good to like have it do that on a regular basis. Like that's what the healthy fats do. Yeah.
So I would agree with that.
Don't avoid fat altogether. Obviously we need fat anyway, but it like keeps your gallbladder doing what it's supposed to do. Yeah. Is that right?
Yeah. Okay. And that's kind of how you get sludge. Like the gallbladder just isn't squeezing the salts and the bile acids out. So you get kind of this sludge in there that's not moving anywhere. It's kind of like it's almost like coffee grounds.
Gross.
Yeah.
Very gross. No, of course you don't. That's why you're a doctor. And exercise too, apparently is supposed to be good preventatively, just to like keep your body fit and
Well,
healthy?
also I think if you're exercising, yeah, you're usually doing the other right things. But
Mm-hmm.
maybe that exercising and like the jostling of it is going to help with peristalsis of your
Mm-hmm.
gallbladder, squeezing
Maybe.
stuff out. I don't know. It helps your gut move, motility.
Right. Yeah,
So
kind of makes sense. It's all related.
yeah. So I think with
Okay.
this one, diet modification is actually a very good thing.
Mm-hmm.
You can always get surgery, and I'm just not a huge fan of the surgery. Not that it doesn't have its place, and so when it does have its place, I am a huge fan of
Mm-hmm.
surgery. But sometimes I feel like maybe people, if they change their diet, they could actually get through it without the surgery. And a lot of people, and this isn't everybody, but a lot of people after surgery will have profuse diarrhea.
Like just chronically.
Mm-hmm.
Okay.
Like this is an everyday multiple stool diarrhea type of thing.
Wow.
Yes, and it's a known common side effect of the surgery. It's a consequence of
It
your
seems
surgery.
like that might give you pause.
Yeah.
Like,
And it's
do you really need
it's
this?
fatty diarrhea because now you don't have
Mm-hmm.
anything to, absorb those fats and stuff. So it's like just constant diarrhea. And so we do have medicine for that, and we do
Mm-hmm.
treat that with medicine. But you're taking this medicine, usually I start people on twice a day, but usually the most common dosing of it is somewhere between 3 and 5 times a day. That's a medicine. So
That's
that you
a
don't,
lot.
yeah, so that you're not having diarrhea. But the diarrhea from gallbladder surgery is very life altering.
What do you mean?
Like you have to plan your life around where the toilets are.
Oh.
Yeah. So, for people to take a medicine 3 to 5 times a day and they're not worried about where the toilets are,
They'll
if they're
do it.
gonna like poop their pants, then they do it. So
Yikes. And if you continue a low fat diet, like does that improve the diarrhea, I assume? Or
I would think so.
okay.
It's kind of like, when people take metformin and they get profuse diarrhea because the way metformin works,
Right.
it binds up the sugar and you poop it out. And so if you have a sugary diet, guess what? You're going to get diarrhea. If you have a fatty diet, you're going to get diarrhea. So if you switch over to a lower fat diet or a different fat diet, then you're going to, a healthier fat diet. But usually when you're doing healthier fats, you're not doing, it's not like you're eating 2 tablespoons of oil. Do you know what I mean? At one time.
Right.
You're doing it in moderation throughout the day. Usually, those unhealthy fats is like pizza, and it's pizza from Pizza Hut. You know what I mean? It's like
right.
fatty
So it's a big
pizza.
dose of unhealthy fat.
Or it's fried chicken.
Yeah.
That you fried in, some kind of Crisco or vegetable oil, or like like a cheeseburger from McDonald's with French fries. You don't just eat the cheeseburger, you eat the French fries too.
Sure.
So it's this other added extra yucky fats that are going in at the same time. Whereas like if you had a salad with some cheese crumbles on it and some nuts, you're not getting that fat load at the same time. So that might be more of what's doing it.
Got it.
So, even maybe the diarrhea would be helped afterwards with people changing their diet. There is a gallbladder diet, right? Yeah.
Pretty much. It sounds like there's a couple of layers here for the diet. Like there's the preventative. If you're, I don't know, why would you do prevention? Like, why would you assume prevention?
I think prevention would be for someone who is intermittently having
has already had some sort of,
like they know that it's coming from their gallbladder, but they don't want to have the surgery, and they're not having bouts like 5 times a year. It's like maybe once a year or something like that. That would be more of a prevention, I would think.
Got it. Or you could just decide like, hey, I don't want to have that, so I'm going to follow this prevention diet. But yes, it's more likely you've had some sort of sign of gallbladder issues, and you've got an opportunity to kind of turn things around diet-wise. So healthy fats, and fiber, fruits, vegetables,
makes sense.
legumes, whole grains,
Yeah.
and then the exercise and all that stuff. So that's your preventative diet. Now, if you're having a gallbladder attack, and maybe you've had several and your doctor is like, okay, that's it, we're having surgery, but like, it's not tomorrow.
Yeah.
So now what you might do is really limit fat
fat.
intake, right?
Yeah, to calm things down.
Yeah.
So
Yeah.
the gallbladder isn't constantly trying to
Mhm.
smush out.
You
stuff.
might even like fast for a bit.
Mhm.
It depends on how much pain you're in.
Yeah.
Because if you eat nothing at all, like eventually the pain is going to stop. Obviously, that's not like a long-term solution.
Right.
But that might be where you're at. It's like just stop eating for a little bit, let things calm down, and then follow a very low fat diet. But still the fiber, you still need the fiber.
Yeah.
And then if you have surgery, so after the surgery, initially you kind of go slow with things,
right?
Which, like almost any surgery, I would think.
Yeah.
Small, frequent meals. Avoid caffeine, fatty foods, of course, spicy foods, and then increase your fiber kind of slowly and gradually. And then I think like the amount.
Can reintroduce some of the fat.
Right. So the amount of fat you can eat and tolerate is pretty individual. So you kind of have to play around with that.
That's why some people get worse in eating diarrhea than others. Some people don't have that problem, but lots of people do.
Yeah. So if you're having diarrhea, then obviously you cut back on fat, and because that's the root of it. And if it's intermittent, then maybe you can kind of see that there are certain foods that are causing a problem for you.
And then you could just avoid those.
And you could just avoid those
because they're not happy, or they don't make you happy.
They don't make you happy. So why are you eating that?
Right.
But it's from. I mean, I think for a lot of people, it could be that you don't have to do anything specific, like to your diet permanently after surgery. For some people, sounds like for some people it's just always going to be terrible. But then there's other people that might be fine.
I think you're right. But I think that people that are at the point of surgery that are having multiple attacks, they're making stones. Usually they're making stones. And the stones have gotten so big, or there's so many in the gallbladder that the gallbladder physically cannot squeeze anymore to squeeze out any bile salt. And some people are stone makers. Like they make stones in their gallbladder, they make stones in their kidneys. They're stone makers. And those people should be following a specific diet anyway, because they're stone makers. So that you're not because it's not like we can take your kidneys out.
Right.
So those people should be following a certain diet to cut down on the stone making.
Right. That makes sense.
But also, if you're constantly having gallbladder attacks, you should take a look at your diet because it's coming from that.
Okay.
Sorry.
So are there's some risk factors, right? So besides the diet, but like people with diabetes are more at risk for
because of their diet.
Stones.
Think of their diet.
Oh.
Yeah.
It's not diabetes itself. It's because you have.
It's your diet. Yeah. And then overweight. Diet.
And then
people over the age of 40.
40. Good grief. That's rude.
Diet.
Whew.
That's because you've had 40 years of diet.
Got it. Okay.
And then there's stone makers. Some people are stone makers.
Some people are stone
that's going to put you at an increased risk.
And if you have intestinal things like Crohn's or other.
Sure, that's autoimmune. And you're not going to be, when you have chronic inflammation, things just don't work around the areas correctly because that inflammation doesn't just affect that organ. It's, usually multi-system, even though we say it's like this. But even Crohn's has actually extra outside of the gut symptoms that has skin changes,
okay,
joint pains,
because
and things like that.
All because of the inflammation, probably.
Yeah. So again,
okay.
Yeah.
There you go.
I think women actually are also at an increased risk of gallstone.
Oh, really? Add it to the list. Joys of womanhood and
Mhm.
over 40.
I'm not over it yet. I'm there. I'm knocking on the door.
I'll let you in, don't worry.
Oh, thanks. I was hoping you'd slam it in my face and I could walk the other way. But it doesn't really work.
We don't
that
want any.
way.
They're all filled up.
So, anyways, there you go. There you have it.
Is. Healthy diet. That's the whole story. It's
Really
a fiber.
Isn't that sad? I mean, it's happy, but it's a healthy diet can do so much for you.
Right. And a healthy diet looks like fiber, people. It looks like fiber.
It does. Fiber, whole foods, and legumes. I mean, legumes are fiber, so.
There you go.
But fiber, whole foods. Really, that's your diet. And water.
Mm-hmm.
There we go.
Yeah.
We keep saying this.
We are a broken record over here.
Yeah. Okay, so so now we've smushed the gallbladder to death. We've squeezed it out and taken it out, and now we realize that we should have just eaten better. And so next time we'll have another surprise topic, which we don't know what that will be yet. And that's going to be in 2 weeks.
Yes.
2 weeks. So we hope to see you in 2 weeks, and hopefully we won't have floated away by then, and that the rain will have stopped. Yeah, we'll have sun, but probably it'll be 100 degrees, and we'll be like, "There's the rain."
It's so hot. That'll be me for sure.
Yeah, me too. I hate 100. So, anyways, we hope that you have a lovely rest of your day, and if you have any questions on the gallbladder, please don't hesitate to ask. Or if you have a topic you want us to talk about, toss that to us too. So, have a great day. Bye bye.